So welcome to Making Transit Work for Essential Workers, Reflections from Interviews with Commuters During COVID-19 Pandemic. My name is Sarah Bars, and I am the chair of the board at Seamless Bay Area. So why are we here? What are we doing today? Well, at the invitation of Karen Frick, the UC Berkeley professor of the Graduate Transportation Studio course at the Department of City and Regional Planning, as well as Eric Eidlin, a member of Seamless Bay Area's Policy Advisory Group, Seamless Bay Area became a client of Transportation Studio this past fall. Becoming a client in this case just means that we are able to work directly with the extremely bright up-and-coming transportation policy professionals and researchers on key questions that we mutually wanted to understand. For this project, we wanted to know how the existing transit system in the Bay Area did and did not serve the needs of our essential workers. So Seamless Bay Area and our partners could better advocate for informed and impactful policies in the Blue Ribbon Transit Recovery Task Force and beyond. As a Cal graduate myself, I'm very pleased to share the results of this Transportation Studio research. You'll be hearing from UC Berkeley graduate students Karl Reinhardt, Amy Thomson, and Andrew Tate about their interviews of essential workers using transit during the pandemic. During the presentation, we encourage you to submit questions or share your perspectives via the chat. We've also enabled private chats in case you'd like to reach out directly to one of the presenters. After the presentation, we're reserving about 20 minutes for you to ask questions, either in the chat or directly live if you raise your hand. So I'd like to quickly introduce our presenters and researchers. Amy Thomson is a second-year master's student studying transportation with a focus on public transportation access and human-centered design. Amy, I don't know if you can wave, but you should wave. Karl Reinhardt is graduating this month from the dual Master of City Planning and Master of Science in Transportation Engineering program and has focused on public transit and micromobility during his time at Berkeley. Great. Karl should wave. And Andrew Tate is a second-year Master of City Planning student and has focused on issues of equity within transportation. So, Andrew. And with that, I will turn it over to our researchers so that they can tell us about how to make transit work for essential workers.
Awesome. Thank you for those introductions, Sarah. And thank you everyone for joining us today. As Sarah said, we are city planning graduate students at UC Berkeley and have been working with Seamless over the past 3 months through our studio with our professor, Karen Frick. We've basically been interviewing a lot of Bay Area residents making essential travel during the pandemic. And so we're excited to share our reflections on that today. We'll start off by giving you a bit of background around our motivations and goals for the project, and then walk you through the methods we focused on, which came in the form of journey mapping interviews with essential travelers. Then we're going to spend some time discussing our key findings and areas of opportunity when it comes to regional transit. And as Sarah said, we'll have the second half of today be open for discussion. So going into this project, we really felt as a team that we couldn't work on a topic in this field without thinking about it through the lens of the pandemic. While COVID-19 meant working remotely for many people in the Bay Area, tens of thousands of residents still use public transit every week. Not only are these travelers having to face the very real risk of COVID every day, they're also dependent on transit agencies that have faced strained budgets and massive service cuts. And the burden of having to travel for work on transit puts certain people at greater risk at contracting the virus. In particular, in California, Black and Latinx residents are more likely to not be able to work from home, meaning this risk is placed disproportionately on those populations. And actually, in a national study, the Transit app found that those still using their app are essential workers and are more likely to be Black or Latinx as well. Thus, understanding the needs of essential travelers riding transit is also a racial justice issue. At the same time, transit trips for essential work impact everyone, even those privileged not to choose whether or not to take transit right now. We like this quote. A leading transportation professional, Tamika Butler, said, "We have to get out of a mindset where there are only certain people who are transit dependent, because we are all transit dependent. We are all dependent on the people who are transit dependent. So we are all transit dependent." And we really like this quote because it takes a holistic approach to how transit affects entire regions and economies. So many transit agencies, specifically here in the Bay Area, making service cuts. Essential travelers who often rely on transit are greatly impacted, as are the communities that depend on their work. Now, we struggled a bit with defining the essential worker throughout this project, because traditional definitions felt somewhat limiting. So we didn't want to limit ourselves to just frontline and healthcare workers, but we're really interested in those that need to take any trip in order to protect their own livelihood or care for their loved ones. So this led us instead to define what we saw as essential travel for anyone still physically traveling during the pandemic. Thus, this presentation is not just about commute trips for frontline workers, but about all essential travel on transit. Also, because we wanted to gather experiences about the transportation system in general, we were also open to talking to riders taking essential trips via other modes beyond transit. So through this project, we wanted to study the different touch points of essential travelers' trips during the pandemic. We wanted to determine both the positives and the negatives so that we could try and think through solutions to reduce some of their pain points, but also help elevate the areas where people are still able to enjoy transit even during COVID-19. And again, while we focused on transit riders, we also spoke with drivers and a cyclist to understand commute motivations. Because driving is the most common commute mode in the Bay Area, it was helpful to document these experiences as a comparison to understand why some chose driving for transit. So we started out by talking to regional agencies and advocacy groups to better understand the main issues that they were aware of and how the pandemic has further put a strain on those issues. So over the initial 12 weeks, we spoke to 24 professionals at a dozen different public agencies, nonprofits, and advocacy groups to gather their perspectives. And then we interviewed 11 essential travelers in the region in English and in Spanish to map their commutes and understand the highs and lows along the way. So by talking to riders from the region, we were then able to uncover some of the commonalities with issues in the region and brainstorm potential solutions for those friction points. And we wanted to focus on this qualitative method to capture nuances that can only be uncovered, we feel, by listening to these individual stories. So this also helped us work quickly over the 3-month period to begin to understand how the pandemic has impacted essential travel. And while we feel like this research is exploratory, further interviews could definitely build on our findings. So to reach the people and communities we wanted to talk to, we began by interviewing transit professionals and advocates and getting their perspectives on the unique issues that the people were facing while taking essential trips. So we heard about perennial issues that have always been kind of topics for the region. So things like full fare integration, diversifying transit revenue streams, and equitable fare schemes. But then we also heard about topics related directly to the pandemic. Things like empty transit stops, and infrequent service, creating the perception of personal safety concerns, was actually a major topic that came up both in these interviews as well in the interviews with essential travelers later on. We also discussed ideas of private vehicles filling the gap that transit service cuts create, and the strain on a regional system when it has to create a single comprehensive public health response that doesn't lead to confusion for transit operators or riders. So these initial interviews really helped give us an idea of what questions we needed to ask and reinforce the importance of us talking directly to essential travelers. With COVID-19 creating a truly unprecedented set of circumstances for the region, we knew there would be unique and compelling stories that we, again, could only learn by talking directly to the writers. So now I'm going to pass it on to Amy to walk you through who we heard from and go over our journey mapping interviews.
Thanks, Andrew. As he said, I will take you through our process, and briefly introduce you to who we met. Journey mapping is an interview process used to gain insight into riders' trips. The goal is to understand each segment of the trip, what touch points the rider has along the way, and which may be important in their decision-making process, such as what time they leave for the bus and why. Since the team couldn't be in the same room, we had a virtual workshopping session where we used Jamboards within Google Suite and used the sticky notes you see above to help us really break down the positives and the negatives of the journey and identify opportunities for improvement. Then we created graphics. We spoke with 11 people taking essential trips to learn about their commutes, many of whom use multiple operators or cross county lines. We spoke with 3 Muni operators who commute to San Francisco, 4 hotel associates who commute to Palo Alto and have their transportation paid for by the Palo Alto Transportation Management Association, which we'll refer to as the TMA, and 4 attendees of a food distribution event in Fruitvale in Oakland, one of whom was working at the free COVID testing site located there. Interviews were conducted in English and Spanish, and everyone received a $25 gift card for their time. Also, the names have been changed for anonymity. I'm going to briefly walk you through who they are and a few journeys. Unfortunately, we can't zoom in on all of them, but I will zoom in on a couple. And please note that this map is not to scale and locations are not exact. First, we met Brian, an SFMTA bus driver who drives to work. And next, we met Daniela, an SFMTA bus operator who also drives to work. Both Brian and Daniela have taken transit to work before, but it was just too complicated and so much easier to drive. And so once they had access to cars, they drove. And Daniel is an SFMTA operator who bikes to work. This is Daniel's journey map, where each notable decision or touch point is a segment highlighted in a box. Stressful segments are red and enjoyable segments are green. Daniel lives within walking distance from one bus yard, but he chose to start work from another farther away so that he could bike there because he enjoys it. It's mostly a flat ride with some time along car-free slow streets in San Francisco. He really values routine and stops for lunch at the same place every day and says hello to the owners. This is where we started to see the common feeling that a commute is a sacred routine for people. The final segment of Daniel's ride home is red because cycling home at night can be stressful. Then we went to East Oakland, where 3 out of 4 interviews were conducted in Spanish. First, we met Evelyn, an East Oakland resident who takes the bus to and from work as a caretaker in San Leandro 7 days a week. Evelyn uses the AC Transit app to see if the next bus is accepting passengers. During the pandemic, buses often switch to drop-off only, which means that passengers can exit, but they should not board because the bus is at capacity to safely practice physical distancing. She often has to wait for later buses because the next one that's coming is too full to practice physical distancing, which will increase her commute time. She takes the bus twice a day, 7 days a week, and pays for each ride respectively. If she's going to take more than 2 trips, she will buy a day pass for $5.50. It's important to note that we met Evelyn at a food distribution event where she was picking up free groceries and she's overpaying for transit. This is an issue with AC Transit and likely other agencies not reaching transit riders or providing accessible monthly pass programs. Another common theme that Evelyn noted is feeling unsafe at bus stops at night and while she walks home. The pandemic has brought ghost town transit stations, interviewees told us. Next is Victor, an East Oakland resident who leaves his self-described crowded home in deep East Oakland and rides the bus to Fruitvale every day to visit food pickups and look for work. He always travels by bike from home to the bus stop because it lowers the chance that he will be robbed, which has happened before. At the bus stop, when the bike storage is full, he's frustrated when he has to wait for the next bus, both because of time and safety. And next we talked to Gabby, an East Oakland resident caring for her son full-time who has many doctors. She often travels to the hospitals near MacArthur-Bart on transit. Gabby is one of a couple interviewees we spoke with who uses a printed schedule. Because she lives so close to the bus stop, sometimes she will walk to the bus stop to check the printed schedule there. She noted that the bus is never on time. And not shown on the map because the trip is too short is Ricardo,
an East Oakland resident who travels 15 minutes on the one bus, the new BRT line, to work at a free COVID testing site. He often noted that the high frequency of this bus line made his trip really simple. And now we're moving to Palo Alto. Victoria works in accounting for a hotel in Palo Alto. She is one of the 4 employees we spoke to who have their transit costs paid for by the Palo Alto TMA. The TMA is a nonprofit organization that works to reduce car traffic and demand for parking by managing public transportation pass programs. 3 out of these 4 interviews were conducted in Spanish. Victoria lives in San Jose, and she's on a fitness journey, exercising twice a day, which is a part of her commute routine. She works out at home in the morning and then drives to the Caltrain station. She noted that she gets frustrated at the kiosk where she pays for parking at Dawn when she is late to catch the train. But she also stressed that she really enjoys her train ride to work because she can watch Netflix, plan her week, or listen to music. This is something we heard often from Caltrain travelers. The transit is relaxing and productive. Also, Caltrain travelers noted that they feel safe from the virus on the train. On the way home, Victoria mentioned that transit stops, particularly during the pandemic, have turned into ghost towns and feel less safe with less people around. Next, we met Alba, a hotel associate who takes a bus with frequent service, meaning it runs every 15 minutes from Redwood City to Palo Alto, and enjoys being able to look out the window during her commute. She said that she was really quite happy with her commute. And this is Magdalena's trip, who also works at the hotel, who takes the bus to the Caltrain station. Magdalena had some complaints about her connection between Caltrain and the VTA bus, similar to those we heard in Oakland. The bus does not come frequently enough. She often sees it driving away as she's exiting the train. Other times the bus is too full to practice physical distancing and accept passengers, so she's stuck waiting for the next one, which can increase her commute time by 15 minutes or more. Her colleague Brittany takes almost the exact same route of bus to Caltrain. Brittany really prefers transit. She says it feels faster than driving, and she enjoys listening to prayers or music along the way. She rarely experiences any problems on her commute. This is particularly interesting because she uses a paper schedule that she picks up at the train stations. She said she's had problems with the paper schedule being wrong maybe 2 or 3 times in 2 years. If she wakes up late, she will drive to the station and pay for parking, but it's not her preference. Many hotel employees we spoke with had few complaints about their trips. We suspect that this is influenced by the fact that the transit is paid for by the Palo Alto TMA. Next, Karl will discuss our analysis of all the journey maps and the key findings.
Great, thanks, Amy. So now that Amy has given at least a brief description of all the journeys of the people we spoke with, I will go into the key findings we were able to gather based on the synthesis of all the interviews. So we have organized our findings into several different problem areas. And as we talk through each of those areas on the following slides, we will note on each slide which of Seamless's 7 different transit principles apply to the topic areas with the icons shown here. We will be discussing both details about each problem area and potential solutions to remedy them as well. So the first issue we want to bring up is transit reliability. We think this is related strongly to 4 of the 7 seamless transit principles, which we've highlighted in the top right-hand corner here. There is a perception that transit is unreliable to many of the people we interviewed, and this stems from several underlying reasons. Multiple riders mentioned using printed schedules to plan their commute, and were often frustrated when the bus was running late, so apps that provide real-time bus location are not particularly helpful for them. Similarly, many faced reliability challenges because buses often are not accepting passengers to maintain social distancing on the vehicles, so travelers have to wait for multiple buses. One of the people we talked to did mention that she uses the AC Transit app to see if the upcoming buses are too full to accept passengers. Unfortunately, this app does not indicate whether bicycle storage on buses are full because this was expressed as a concern as well. Finally, a lack of coordination between agencies was often cited as a factor that greatly decreased transit reliability. In terms of possible solutions, riders may not have the means to easily check schedules online due to limited cellular data or Wi-Fi access. So Wi-Fi at stops could help riders, but so could simply increasing frequency. This would also help other issues like seat and bike capacity constraints, late buses, and even ghost town transit stations. And to mitigate lack of coordination, a regional transit network operator could better synchronize schedules too. Next, we want to bring up the idea of productive time. So while traveling, transit riders value the freedom to close their eyes and relax, watch TV or movies, or listen to prayers or music. On the other hand, the two drivers we spoke to who had commuted on transit in the past valued the chance to call family and operate on their own reliable schedule with their car. In terms of possible solutions, we heard multiple times that riding transit provides a relaxing and productive space that people don't get from a driving commute. So this could create a unique opportunity here for the Bay Area to work regionally to help create an identity around enjoyable transit commutes. Instead of wasting precious time stuck in traffic, essential travelers can get things done while riding transit or use it as a chance to unwind. While drivers can spend time commuting, talking to friends and family on the phone, transit riders can spend their time listening to music or podcast or catching up on social media or work. A marketing campaign to create a positive identity around being a transit rider could be low-hanging fruit when it comes to regional coordination and budgetary constraints, while helping to entice riders to switch to transit. Transit cost was the next problem area we identified. Low-income riders really valued the bus when it was free, and the East Oakland residents we spoke to were frustrated when AC Transit started charging fares again. Muni bus drivers also commented on how seemingly low-income riders struggled to pay more often, even pre-pandemic, and they wish transit could be free. Transportation fares causing a bigger burden on low-income people, particularly during the pandemic, is disappointing, but not surprising. The surprising finding was that one East Oakland rider mentioned taking additional leisure trips, like a walk around Lake Merritt, when AC Transit was free. This observation shows that a subsidized transit pass for low-income riders is a promising solution. A region-wide program similar to the Palo Alto TMA could increase transit use and reduce cost burden, for example. When speaking with the transit riders who have transit passes subsidized by the Palo Alto TMA, they were very grateful for the transit pass. We even found that they were less critical of transit compared to other interviewees. In addition to a subsidized regional transit pass for low-income riders, removing penalties for transferring between agencies and instituting fare capping would also be beneficial. Seamless's integrated fare vision could address these concerns by ensuring all agencies offer low-income discounts, fare capping, and remove transfer penalties. Our next problem area is payment methods. Riders we spoke to were overpaying for transit and were not aware of all the different fare products and payment methods available to them. One rider we met at a food distribution event was taking AC Transit twice a day, every day, and paying individually for each ride instead of buying a monthly pass. Another rider was paying in cash for the bus and then paying for BART with a Clipper card. Using a Clipper card offers a 25-cent discount per ride, which for one of our riders would result in over $3 in savings every week. We believe this is a pattern of agencies not reaching riders with the best deal, especially those making essential trips during the pandemic. Several large Bay Area transit operators, most notably those with significant bus networks like Muni, VTA, and Samtrans, have observed less use of Clipper Card for payment during the pandemic. And this may be true for AC Transit as well, but they too recently started collecting payment data again to have data. In regards to paying for parking, one interviewee mentioned that the most stressful part of her commute is when she must stop to pay for parking at a kiosk at a Caltrain station, which is frustrating when running late for a train. She was not using the Caltrain mobile app to pay for parking. So with so many fare products available across agencies in the Bay Area, fares should be more streamlined and integrated. Seamless's integrated fare vision, which would unify fares across agencies, has important features like low-income discounts and fare capping. Since the vision's implementation would take time, we think short-term solutions are needed, especially for low-income essential travelers. Ensuring all pass and payment options for transit and parking are clearly communicated in all the languages spoken in communities across the Bay Area could be very beneficial to riders. It's difficult to know exactly why users are overpaying for transit, but we would like to continue researching ways to improve marketing and communication around transit pass programs and rates, with an ultimate goal of accessible pricing and information about fares. Although every system has people slip through the cracks, we were struck that in our small sample size of 11, we found people overpaying for transit. Another issue is perceptions of safety. With transit ridership at unprecedented lows due to the lack of travel demand during the pandemic, our riders expressed concerns about ghost town stations and stops. With fewer people riding transit, essential travelers are more often traveling alone, and this has ignited safety and security concerns for riders. Furthermore, with decreased transit service and less reliability, riders have to spend more time waiting for transit. Late buses increase the amount of time riders perceive they could be robbed or assaulted at a transit stop. Solutions mentioned by interviewees included having more frequent service, which would limit the time riders are alone on the platform. They also mentioned that enhancing lighting at and around transit stops would help to make them feel more safe. This would involve coordination with other public agencies as well, of course. A solution not mentioned that we think is important is community visioning for new public safety approaches that follow principles from abolitionist planning. Finally, COVID-19 concern is the last problem area identified. Some riders, most notably those who use Caltrain, did not cite concerns about COVID exposure while on transit, while others did. We were interviewing in October when infection rates were lower than today. However, SFMTA bus operators cited concerns of catching the virus, and so did riders in East Oakland who ride AC Transit. This was intriguing to us because of the 6 largest Bay Area transit agencies, AC Transit has retained the most ridership throughout the pandemic, averaging 38% of ridership before COVID-19, compared to 11% for BART, for example. So this puts a disproportionate burden on AC Transit in the pandemic, which has maintained the most riders, which could be addressed with more regional transit coordination. In terms of solutions, riders expressed that remedies like free mask and hand sanitizer on transit would ease a lot of their fears of exposure. The transit operators we spoke to also expressed concerns about COVID exposure and want there to be more PPE available in stations and on transit vehicles. Interviewees from the nonprofits we spoke to also expressed that more specific requirements for PPE across all Bay Area transit agencies are needed. This demonstrates that while COVID-19 was addressed regionally in some ways, such as sheltering in place as a region in March, it may not have been fully addressed regionally by transit agencies. In an unprecedented and stressful time, we hope transit agencies are able to address future crises and respond uniformly. So now I will pass it on to Andrew to wrap up our presentation.
Thanks, Karl. So just first, we do want to talk about some of our limitations with the research. With the short project timeline, there were a few areas that we felt could have benefited from future efforts. We felt it was paramount, for instance, that we compensate all of our journey map interviewees, but we had a limited budget and limited time. So we did end up having a relatively small sample size of 11 people. We also had limited time to actually speak with each of the interviewees, usually around 30 minutes. And we also did not focus on collecting demographic data from our interviewees. So all of this combined meant that there were definitely interesting and novel issues that came up that we would have loved to dig deeper into with each of the interviewees, but simply weren't able to. With more time and resources, we would want to look further into questions specifically around public safety and fair awareness and policies. So again, to wrap up, we really were motivated with this project because of the importance of understanding essential travel during the COVID-19 pandemic. Across the US, 2.8 million essential workers ride transit to their jobs. And further, this burden is placed more heavily on Black and Latinx travelers who are most likely to be riding transit during the pandemic. So again, it's important to know that understanding the needs of essential travelers is also a racial justice issue. Also, through this research and by taking a qualitative approach with these interviews, we really feel like we have a new list of values and concerns from essential travelers. So we're very grateful for our interviewees and that they were able to share their perspectives and feelings with us. With that in mind, we feel the work we did here is just the first step in creating an equitable, racially just, and resilient transportation system in the Bay Area. This work is not meant to have established generalizable findings, but rather ignite important conversations about transit and essential travel in the region. So we hope the practice of journey mapping serves as an applicable example for transit agencies and government groups to continue interviewing riders about their trips. COVID-19 will not be the last crisis to affect the Bay Area, and the burden of these crises should not fall disproportionately on certain groups. As we said in the beginning, we may not all ride transit every day, but we are all dependent on the transit system to keep our community alive. Transit is essential for equitable, thriving cities, and we believe this research supports that crisis response in transit in general requires a regional approach. So thank you again for listening to our presentation. We'll be publishing this webinar footage and a blog post with Seamless with more details in the next week. And just most importantly, we want to thank our interviewees, our classmates that assisted with our Spanish interviews, Seamless, and the Palo Alto TMA, and of course our family and friends for all their support. And we look forward to your questions and feedback. Thank you.
Yay! congratulations. Thank you so much for that presentation. And I'm excited that we have about 20 minutes to explore these findings a little bit further. So before we invite you guys to ask questions, either directly via audio or in the chat, I'm gonna turn this over to Eric Eidlin. As I mentioned earlier, Eric is a member of Seamless's Policy Advisory Group. And his day job at the City of San Jose, he works to advance Seamless's principles in his work on redesigning San Jose's Diridon Station, the place in the Bay Area where the most transportation modes come together, and arguably where the challenges of our fragmented regional transit system are most apparent. So Eric will now kick us off for our Q&A session. Thanks, Eric.
Thanks so much, Sarah, and congratulations to the Berkeley students. I really appreciated that presentation, and I'm sure everyone else did as well. So I'm just looking at the chat here, and I think one theme that's coming up here is that, and this also came through in your research, is that in many ways, the challenges that people face in using, depending on accessing transit, in many ways, perhaps they haven't changed that much, right? I mean, and I think you mentioned yourselves in your interviews that COVID perhaps didn't come up as much as you might have expected in your interviews. And maybe that's the first question is perhaps a little bit more about why you think that might be the case. And then secondly, so we have questions about first mile problems, people far from bus stops. And those, I guess in an era of COVID, we have these ghost stop towns these ghost town stops that Amy referenced. So that's maybe something that's a little bit more pronounced. But would you agree then that a lot of your recommendations are sort of more general to things we already knew we had to do for transit? And then if you could also address the perhaps less mention of COVID than you might have expected in your interviews. And I guess anyone, Andrew, or any of you can take that.
I can try the first part of the question about why didn't COVID come up more. So we really let the interviewees guide the conversation, and we wanted their concerns to be foremost our center, to just be at the center of the conversation. And we found that just for a lot of people working, just COVID felt like more of a secondary concern. It's also maybe because we were interviewing mostly in October, where COVID and COVID positivity rates and everything was much lower than it is right now. So that's another potential reason. But regarding the differences in agencies, we did see that on Caltrain, people felt more safe, but also they've lost much more of their ridership than, let's say, AC Transit. And I'm trying to remember what the other question was about.
It was about whether you think your recommendations were, it's more of a reinforcement of things we already knew we should be doing. That's like improving lighting at bus stops, finding ways to make those spaces feel safer, and of course, generally giving more certainty. On one hand, giving more certainty to risers with real-time information. They know when the next bus is coming, being that clear and easily accessible, but also ease of accessing the system, whether it's bringing transit closer to people, having easier to understand fare policies. So do you agree that it sort of reinforced what we already know, or are there some things that are a little different?
I can also jump in with that question. I think one thing we talked about quite a bit throughout the analysis is that in any emergency, existing problems are often exacerbated. And so we saw that happen with our analysis. And I think one example that comes to mind is maybe the feeling of unsafety wasn't new to the pandemic. So women have cited feeling unsafe at transit stations before, and at night when frequency is lower for a bus line, that's a feeling I'm aware of, and I think people on this call can be aware of. And so when the pandemic really hit and bus agencies were dropping service as much as 80%, that feeling was probably exacerbated and felt more often across the region is what we're guessing.
Great. Thanks so much. I think some people are also wondering maybe about your, you said you interviewed 11 people altogether and opted more for, more in-depth conversations with a smaller group of people rather than perhaps a more, data-driven approach. Do you think that was the right approach for this project, or in thinking about future research? Do you think a different approach or complementing, both more qualitative and quantitative methods would be a good idea?
Yeah, I mean, I think we definitely, if we had had more time, probably some combination of also looking at quantitative data as well would have definitely been something that we wanted to look into. I think we all felt really good about this approach, though, especially with journey mapping specifically. It's not something that we found much evidence of cities and planners doing in the past. And the thing is, we found really unique pieces within each person's story that I just don't really think you would find highlighted in like a survey or even things like onboarding surveys where you have to have the person already on the train or on the bus. One of our interviewees specifically was talking about the situation around having to pay for parking and to get to the train. And it was interesting because I think even in that short time period of the 2 or 3 minutes of talking to her just about that one detail, we were able to realize it wasn't so much the having to pay being the burden as much as it was the stress around trying to get to the train on time and being, alone outside early in the morning as a woman with not many other people around. So I think we really felt that doing journey mapping this way allowed us to find details that we wouldn't have found otherwise. So.
Great. Thanks very much for that. I see, I guess in the end of your presentation, you made the general point, which is at the heart of Seamless's work, of course, which is that, transit and, transportation, people's daily transportation is really a regional issue. I think many people here on this call would agree with that. When it comes to specifically the recommendations that you've come up with here that are, more about, the current crisis we're in with the pandemic, why do you think that those, along with transit measures generally, also need to be adopted at the regional level, and why? So of course you had the payment recommendations, you had others. Do you think it's any different from the rest of transit, or is it also really something that, in the interest of essential workers, that also needs to be addressed regionally?
I think, just to give it more broadly, you're like, within each of the topics, we definitely found that all of these issues, like they all need to be addressed regionally, because then it could just create more inequity if they're not. So we thought that was kind of like a big, broad issue within all of them. I'll let Andrew and Amy maybe step in if they have anything else they want to say.
I think you're bringing up a good point, and one of the things that came up in the stakeholder interviews again was the fact that public health concerns around COVID need to be dealt with regionally, and what we've seen so far is that even though there are kind of broader best practices that everyone should be using, you're still finding that because of the nature of the fact that on Caltrain there are just fewer riders right now versus AC Transit, which has kept much more of its ridership. It was apparent with those conversations that there were bigger safety concerns, that clearly like the kind of top-down best practice approach wasn't really working for everyone in every situation. So yeah, I guess to get back to your point, Eric, I think a lot of the things we realized was like, yes, these could be done at an individual agency level, but if we think about this, if we want to think about ourselves and our commuters as kind of Bay Area residents that need to be able to use the entire system, it really is important to have more cooperation between agencies so that the experience is, for lack of a better term, more seamless when traveling between agencies.
Mm-hmm. Yeah, I mean, I thought it was really interesting that data on BART versus AC Transit ridership, and of course, there I think there is an issue of, well, can people do their jobs remotely or not? And BART people perhaps having more jobs that they can use, that they can do remotely. Yet, I guess this again gets to the core of some of Seamless's work, that perhaps some of those essential workers, more of them might consider BART for segments of their trip if it weren't an additional fare, if it weren't a new, different schedule to consult, if the transfers at the stations weren't so unwieldy and cumbersome. I think those are all, that was really interesting. And Sarah, did you want to chime in at all on this one?
Well, I think this discussion is great and spot on, but actually I wanted to break in with a logistical announcement. So we want to allow our participants on this Zoom to be able to ask a question directly to the panelists here, to our researchers. So the way that we propose doing that is you can ask yourselves to unmute, and then a moderator will unmute you so that you can ask your question. So please keep your question on point, on topic. We do welcome feedback as well as questions, but just try to keep it within the scope of what the students did their work on. And I will also say that while we're waiting for those requests to unmute come in, which I'm relying on Stephanie to manage, I will also jump in with a question that was seeded by a comment in the chat, which was about parking at Caltrain and other transit stations. So I was, it looks like James Namba of Caltrain Samtrans did a shameless plug for Caltrain parking issues at stations with respect to the new Caltrain mobile app. I'm wondering, Karl, Andrew, Amy, if you had any comments about what interviewees thought about parking and on the mobile app.
So yeah, regarding that, we mentioned one person we spoke to who, really stressed that parking at Caltrain stations was really stressful, and they used, they were, paying in cash at a kiosk and were not aware of the mobile app. So that definitely would take out like the most stressful point of their commute, was being able to just pay on the map, pay via the app and online instead would make accessing Caltrain in the morning a lot easier for them.
I think one thing we realized along with that, because we were also learning things as we went, because when that was first brought up, we didn't even realize that you could pay via an app. And so I think that just brought us into thinking about the fact that, even though it is maybe easier now to use an app, like clearly there are individuals that don't even know that exists yet. Or maybe like we're not even sure if she like uses her smartphone on a daily basis, so might not have had access to it. So that was one of the things we were thinking about too, was just like there are clearly like solutions to make this a less stressful situation for her, but that the fact that it's available to her still is kind of an issue, and maybe there's more like marketing around that can be done.
Thank you. I don't know. I'm not seeing if I should be able to see if somebody wants to raise their hand, right? I don't.
I guess I just learned that you can unmute yourself. So apologies. I guess the ask to unmute feature isn't in this flavor of Zoom.
All right, in this
So,
version, yeah.
Yeah, if you want to ask your question, please just do it.
Hi, I'm Sarah Saya here. I'll go ahead and jump in. So just really kudos for doing this research. I think it could be very affordable for more transit agencies to do this type of work in-house. So would just like to hear a little bit about your recommendations for that and what that could help with. I was thinking about, just in project planning, really during the early planning process, how helpful it would be to really have that work grounded in with this type of information.
Yeah, I'll just start off quickly with that. Yeah, we definitely just wanted to show that journey mapping could be a community engagement technique that we hope a lot of transit agencies or transportation departments could use. And with that, we also just feel like journey mapping could be a key way to start to build like kind of a local to regional to even state coalition and support for transit and a lot of its issues, because it really humanizes it for people who don't normally ride transit and shows how critical it is.
Yeah, I'll just make a quick plug for it. I mean, it's a pretty low cost, just kind of like a one-on-one interview. And I don't think we would have been able to gather the insights that we did. We talked about, doing a survey. There was kind of a lot of back and forth of what the methodology would be. And the journey mapping was both like really rewarding and effective, I think.
Yeah, as we've mentioned a lot, just like capturing a lot of those nuances that just like you can't really capture in a survey. So that was just like one of the most important benefits of this technique. I see that Kenji has raised his hand. I'm not sure if anyone else, do you want to ask a question, Kenji?
Yeah, thanks for this presentation, guys. It's really good work. You had mentioned that for purposes of equity, integration is on a regional level is more key, but thus far that appears to be requiring the use of promotion of clipper cards. The promotion of clipper cards, like requiring clipper cards and getting rid of paper tickets, thus far seems to have a disproportionately negative impact on a lot of disadvantaged communities and essential workers. So how do you reconcile the two? Like, do we go whole hog and just say, forget it, it's going to sting for a little bit, but then the payoff will be worth it? Or do you propose a more middle approach?
I'll just start off, and I think that's a really good point. You're really weighing a lot of the cost and benefits of like cash versus clipper, and I think something to maybe think about that our interviews kind of touched on is just like because we talked to people who weren't using clipper card and could have been getting some savings from it, but and it could have resulted in maybe like $3 a week for some of the riders we spoke to. But that also may not really be enough because with a better, let's say like an advantage of clipper card that we're not using in the Bay Area is fare capping, for example. Mm-hmm. So that would be a lot more beneficial to low income riders, especially. So there's definitely a trade-off, and I think you make a great point, but I think it's just like, if we're going to push more on clipper card, then yeah, we need to make sure that we're really offering products like fare capping that would really benefit those people who are probably using cash right now.
Thanks.
Yeah.
Yeah, and just to provide kind of a little bit of context, I think in our 3 months that we were really focused on this, our analysis was very heavily weighted in the journey mapping and kind of identifying the problems. And in terms of those solutions, there's so much more to think about. And Kenji, that's such a great point because we sort of identified this disconnect, and now there's a lot of thinking to do of how to move forward both in the short and the long term.
Certainly.
Can I ask a question? This is Diane Shaw.
Sure, go ahead.
The journey mapping is a very interesting technique. And as you mentioned, you were only able to get a small sample. So I guess one of the question I have is, for the bigger agencies who have thousands and thousands of riders trips, do you think getting this, because it does take time to do I think it's a very interesting thing. I think you're right. You can get some really interesting results from it. My question is, do you think there's value in making decisions based on such a small sample size?
I think, well, I mean, it depends, yeah, like on the sample size. For us, with, we only had the resources to do 11 interviews with writers, and we don't really think it's fair to do that based on these 11 interviews. But if we could do at least 10 times that and make those specifically in communities that we know could really benefit from a lot of transit policy changes, then I think you really could start to make a lot of policy decisions based on those interviews. And I'll let Amy and Andrew, I think, are unmuted, so I think they have things to say too.
I guess I was just gonna also bring up the point that, this technique comes a lot out of the idea of around being able to do very fast-paced, iterative, human-centered design. So, even though it did take us time to like interview these people, I think one way to kind of approach it would be that this is like a way to like seed ideas and be like an initial round of research that again can definitely give you insights that maybe you wouldn't get at the end of a full-scale survey. And so that would maybe be one way to like kind of incorporate it into like research methodologies. It's like have it on the earlier end and help you figure out what kind of questions to ask further on and like in bigger efforts later on.
Gotcha. That makes sense. And Karl, did you have a percentage of what you thought percentage of riders or something that you think would make a good sample to be looking at? Had you guys thought about that?
We haven't thought about that yet, I'll say.
Okay, thanks.
Great. All right, well, we are just about out of time, but just in closing to the students, you conducted this research in a unique period of time, the pandemic. What do you think are in one sentence, the most enduring, the most relevant findings of your research, or the single most relevant finding into the future after the pandemic is over?
I think it's
feel like Kai Ryssdal, 5 words or less.
Yeah. I think I would say the one thing, and this maybe feels cliche, but my thing would be the fact that we as planners always talk about transit as being essential, but in the end, like we are working in a system where it is not treated that way. And so like, when we talk about the fact that a lot of the issues that are already there are just exacerbated by something like a crisis like COVID, normally you might be able to take the train at the end of the day, but now service cuts means earlier stops for service. And so like things like that, where issues just are exacerbated, it really would take a difference in thinking regionally as like these services, yes, might be expensive, but like they are the lifeblood of a region. So like they can't just be cut off.
Great. Well, I'd like to hear from all 3 of you, but I think we're out of time. So I would just like to thank you and turn it back over to Sarah to close us out.
Yes, thank you. Thank you, Eric. And thank you, Amy, Karl, and Andrew. So I'm just going to take another minute here to wrap us up. Unfortunately, we're out of time for questions. However, if you still have questions, you're welcome to put it in the chat. We're going to save the chat and try to address all lingering questions and feedback in the following blog post, which, as Andrew mentioned, will be published on the Seamless Bay Area blog within the next few days. And I just wanted to give a couple of shout outs and plugs. So building on this work, Amy is in the process of interviewing SFMTA bus drivers to learn about their experiences during COVID-19. Her goal is to provide a set of recommendations to improve the bus network overall and for the next time that we respond to a crisis. So please feel free to reach out to Amy if you're interested in that work. And I'd also say that in this dire moment for transit, it has never been more important for our region's leaders to listen to the voices of essential workers who continue to rely on transit and do their jobs and serve our community. So if you support this kind of work, I urge you to make a donation if you're feeling generous to one of two places, either Seamless Bay Area. We're about to drop a donation link into the chat, seamlessbayarea.org/donate. And I would like to emphasize that all of our gifts to our 501c3 Seamless Bay Area Alliance are tax deductible. And in addition, please support UC Berkeley's College of Environmental Design Diversity Initiative. We'll drop a link into the chat for the college's Diversity Fund, which works to fund students and their work around diversity, equity, and inclusion. Go Bears. So with that, thank you all. Have a safe and healthy holiday season, and we'll see you in the new year. Take care.
Thanks so much.
Thanks, everyone.